Hi, today I wanted to talk to you for a couple of minutes about the assessment framework for assessing a newborn and assessing a neonate. So, just opening up the Moodle shell, let's go to the neonate and newborn section here, chapter 7. You've got your lessons in here already on newborn. I have finished the lesson on neonate, but I haven't actually recorded it yet. So, I want to take you to this, the neonatal assessment framework. Click on here and it's going to open up into another screen, like so. So this is the overall view of both newborn and neonate. It's going to be a little bit difficult and different, challenging for you when you look at this framework and you try to go through, depending on what you're faced with. So initially, this main framework is set up for an assessment of the neonate. Now, as we know, the neonate is 28 days old or under, so it's not necessarily for the newborn. However, this yellow part here is assessment of the newborn only. So when we're going through our scenarios, our case studies, and we want to do an assessment in a structured framework, first of all, what we'll do is we will come in for the newborn. We will look at the mother, see whether mother is in the active stages of giving birth or not. If she's not in the active stages of giving birth, then she is our patient. It's an assessment of the pregnant patient. If she's about to give birth, we start thinking about the newborn. So, like I said in the lecture, first thing I want you to be thinking about is resuscitation. So, not a nice way to go about thinking about the beautiful joy of a newborn baby entering the world. However, for a paramedic with a responsibility, you have to have it in the back of your mind. I've gone on about that enough. Now I want to tell you what to do when it comes to the assessment. So if this is your OSCE, you are pretty sure on the way you're going to go about it. So checking for danger. Is there a baby either about to come out or has just come out? So let's say baby birth is imminent. We're going to introduce ourselves, gain consent from the parents, have a look at the environment, make sure it's nice and warm, make sure she's as comfortable as she possibly can be, and that you've got everything you need, including your maternity pack and anything that you might want for resus. Call a midwife if the midwife's not already there and if you have access to the midwife. Taking a full patient history of the mother, that is Socrates. Misfits is a new one for you, but this is a cause of altered mental status in a newborn. So I'm going to do a separate little section on that, but we'll come back to that. That is if baby's born. Explaining the details of the physical assessment. So if the birth is imminent, what I want you to do is say to the mother, the parents, whoever else is in the room, that when the baby is delivered, that you will be carrying out an initial assessment. Once the assessment's complete, you will be able to ensure baby is warm and give baby back to mother or parents or whoever. So we're going to skip right down to the birth of the baby. So assessment of the newborn. You might be thinking pediatric triangle in here. Pediatric triangle is really good for being able to look at babies in a flash, that kind of thing. But what we need to do for the assessment of the newborn is go to immediate assessment at birth and APGAR rather than the pediatric triangle. So although it's still in our head, although we're still thinking about the work of breathing, the circulation to skin, and the appearance, we're going to talk about it in a new and different way. So I want you to do your immediate assessment first of all. Baby's in your hands, check the baby, prepare for resus. So colour of the baby, the tone of the baby, check the baby's heart rate, check the baby's rest rate. Now you know from the last lecture that at this stage, if the heart rate is not adequate, you're going to be starting resuscitation. Adequate means less than 60. So you're checking, is this a really, really unwell baby, or is the baby okay at this stage? Big sick, little sick. So if the baby's not all right, you're going to go into the full resus mode. You're going to be doing your inflations without oxygen. You're going to be doing your 30 seconds of ventilation. You're going to be doing CPR with your circumferential technique, and you are going to be doing a rate of 3 to 1 for newborn. If the baby's not in a resuscitation mode, if the baby's kind of all right, you are going to carry on with your assessment. Make sure that you're going to dry the baby, warm the baby. Remember, I talked on and on about that. Yeah. We're going to keep them nice and warm in the towel, put the little hat on them, etc. Keep the room nice and warm. We're going to do our ABGAR assessment straight afterwards. Remember when we do our ABGAR? Immediately, so after 1 minute, and then after 5 minutes. And then if the baby is not at the top score, then we're going to do it every 5 minutes after that until we are sure that the baby is stable. So ABGAR score straight after warming the baby. So initially, I want you to look at the baby and do appearance, pulse, grimace, activity, and respiration. That's a bit like your pediatric triangle, isn't it? So without saying the words pediatric triangle, that's what you're doing. Your initial assessment at birth, warm the baby or resuscitate the baby, and then ABGAR, 1 minute, 5 minute, 10 minute, 15, etc. Okay? That is your assessment of the neonate. As we said, misfits is something else which you can check for the mental state of the baby. That is it in terms of if you get given an OSCE for the neonate assessment. And hopefully that's clear. I want to go through this with you to make sure that you get it. So you wouldn't be deducted marks, for example, if you didn't say, here are the factors of the pediatric triangle. What I want you to say is going in, checking for danger, checking what status the baby's in. If birth is imminent, I'm going to prepare to resuscitate. I'm going to make the mother comfortable. I'm going to make the environment warm. I'm going to take a brief history. Birth is imminent. Baby's coming out. I'm going to do my initial assessment. If the baby needs resuscitation, I will resuscitate the baby. If the baby doesn't need resuscitation, I will make sure it's lovely and dry and warm and wrapped up, and then I will do ABGAR on 1 minute, 5 minute, etc. And that's it for newborn assessment. I said neonate because it's written here as neonatal assessment at birth. I hope that's not too confusing for you. But the yellow bit is just the newborn. The blue part, on the other hand, is an assessment for the baby that's up to 28 days old. So we're talking about different feeding types. We're talking about the illnesses that tiny newborns can get, but not necessarily illnesses that you will see with a brand new placenta still in the room baby. They haven't had their feeds yet. They haven't had their first poo yet, some of them. So the assessments are very different. So we've talked about the newborn assessment. Now we're going to talk about the neonatal assessment. So let's imagine you have been called to a 3-week-old baby. You're going to take a lot of history from the parents, first of all. You're going to be asking them about the that's birth, delivery, DELIRF. You're going to be asking them about the pregnancy. You're going to be reading their notes. You're going to be talking about the birth, any complications, and you're going to be talking about how the baby has been up until these 3 weeks. So it says here, discuss any concerns with the parents and read the maternity notes. Fine, grand. Next, you're going to be assessing feeding. Now, when you come to the PowerPoint about this, there is a lot more information in there. So there are specific things for you to ask in terms of how often does the baby feed? How often does the baby wake from sleep to get the feed? How often are there wet nappies, etc.? So you're going to be considering all that in one. You're going to be thinking about the feeding and digestive illnesses which can affect a brand new up to 28-day baby, or even sometimes up to a couple of years. But this is what you're thinking. You want to be thinking about the volvulus, the intussusception, and the pyloric stenosis. So you'll read more about that in my latest PowerPoint, which is the assessment of the neonate. They are to do with digestion, and they're very easy to spot in terms of babies' stools, babies' kind of positioning with their abdomen, and their feeding habits and vomiting habits. So read more about that. As always, in pediatrics, you're going to be looking at the signs for dehydration. You're going to be thinking about sepsis. And in this section, you're going to be thinking about hypoglycemia as well. Not to mention, not to forget to mention the position of the baby. So this here bit here, knees bent and raised, equals abdo pain. So a little 28-year-old, 28-day-old will not be able to tell you that it's got abdo pain. It'll be crying, but you will think to yourself abdo pain because of this position. Always we're going to be looking for signs of infection. Then we come to the safeguarding in everything. We do have safeguarding concerns in the neonatal assessment at birth, but we do have to consider up to 20-year-olds a little bit different from the baby in the room. All right, so two different type of assessments that's given to you on one assessment framework. You pick which one you're going to do, whether you're going to do yellow or whether you're going to do blue. We're going to practice these in our breakout rooms on our online sessions. If this is an OSCE, what I'll do is I'll separate them into two different assessment tools for you. But they're both very short, so that's why they're in as one. I hope that's clear. If it's not clear, please get on the forum and nag me. I will make it clearer for you. All right, so for now, that's it in terms of the assessment. We'll go through this on our online sessions. And if any changes need to happen, let me know and I will do that. All right, thanks for listening.